I'm Catherine. I'm a patient at Queen City Health Center, and I originally came into the office because I hurt my back when I was helping my parents move, and this is my mom. I was helping her move, and since then I got a couple of adjustments to reduce the pain in my back, and then over time as I started getting adjusted more often, I realized that I was sleeping a lot better. My back wasn't sore when I was sitting or getting out of bed in the mornings, and my digestion really improved. So as a result of all of that, I wanted to bring my mom in because I realized how many benefits there were to getting an adjustment, and I knew that she had struggled with digestive issues and sciatica and sleep issues. So eventually, after a couple months of me hounding her, she decided to come make an appointment, and now she's the one that is trying to convince other people to come here. So
yes,
take it away.
I'm Faye. I'm her mom, and I did not listen at all at first because I had my preconceived notions of what a chiropractor was. But I had excruciating sciatic nerve pain. When I would drive over 2 hours, I would be in tears and have to switch drivers, and it was just really uncomfortable. So so I decided to take a risk and come in, and I have really enjoyed it. I was skeptical for a while, but I have come across the line. I'm very I'm a full believer now. My sciatic nerve has improved tremendously. I drove recently over 2 hours with no pain. My digestive system is better, but the biggest thing was I was having sleep issues, and I am shamefully going to admit that I took Benadryl every night to go to sleep, and much to everyone's dismay, after I started here, after the first adjustment, I stopped taking the Benadryl, and I've not taken Benadryl since, and I'm sleeping so much better with no sleep aids at all. So that to me is huge. Better rest, I feel better, and I'm very thankful that I got to experience this. I'm especially thankful I got to experience it with my daughter. She's just been an inspiration to me, and then we've been to I've been to 2 community dinners.
I've been to 2. We've been to 1 together.
Right, and I thought they were very helpful. I thought the staff, Lauren and Haley, are awesome. They they take care of everything, and they really do try to engage and get people to come in and to just try it out. And I'm trying to right now get a friend of mine to come in because of her back issues. But
you change your diet.
Yes, in fact, she's actually made an appointment for her daughter to come in. So I'm working on that family. But anyway, it's been a great experience. I've got a lot more treatment, and I'm going to improve a lot more, and I look forward to that.
Well, she didn't understand what the end goal of the adjustments were, and it's kind of like there's no really end goal. It's just a movement towards getting rid of all the symptoms. And every time she came in and got adjusted, I think there was a little bit more of a
realization.
Yes, and getting rid of that skepticism. And I think that to get her to come in, I just was like, okay, like what it did for me, just give it a shot. Like just do 1 time, and then every time it just kept getting better, and then she was kind of locked in.
I think for me, the concept of chiropractic, is that the right word?
Chiropractic.
Yeah. That it's kind of, at my age, I'm 58, it's gotten a bad rap before, the fact that you go in, adjust, and then there's no end to it, and it's not really practical or economical. But I think what Dr. Kyle has explained is the healing process, and that diagram with the nervous system really makes sense to me as far as getting out of your body's way, and also to alleviate the areas that are making it difficult to heal. So I know what the long-term goals are now, so I understand more his philosophy and just the whole concept of going to a chiropractor.
Well, I'm definitely going to be more open to the idea of referring my patients to go to a chiropractor. I know that there are MDs and DOs in Charlotte that refer patients to come to chiropractic care and to come here. And I think that as there's more and more research and funding that goes into chiropractic research, patients will have even, less skepticism, like how Faye was saying she was, nervous, not really understanding what it was. But I think that there's a gap right now between the two, and there's no reason not to want to explore, how they can both fit together.
For me, this will be just part of my, after I get through the 3 months, this will just be part of my weekly, once a week, come in and maintain, because I don't want to backtrack and want to keep moving forward. So it's just like you were saying, you can incorporate it into what you consider your exercise, eating well, getting adjusted, making sure the body's set up to heal.